Good evening, everyone. Welcome. My name is Dr. Jesus Cepero. I'm your Chief Nursing Officer, and it's an honor to welcome you here tonight to the 6th Annual Nightingale Awards. And my first, by the way. Really, the last 10 months that I've been here have been an honor and privilege to serve you as your chief nurse, and I'm so looking forward to working, getting to know you, and really helping the organization move forward as far as patient care services, safety, and patient experience. And I could not be more proud to be a small part of this organization by leading you as your chief nurse. So thank you for your support. So our first speaker is going to be Mr. Paul King, our President and CEO. Paul? Why don't you come here?
I wore my mask so that I could have a dramatic reveal. Was that dramatic enough? Kind of, sort of? Great, thanks, everyone. Anyway, thank you, Jesus. I had Luanne written on my thing because I didn't know you were going to be introducing me. So thank you, Luanne. And good evening, everyone. Welcome to our 6th Annual Nightingale Awards celebration. Once again, our organizing team had to work their special magic to make sure that even though we're still dealing with COVID, nothing was going to stop us from celebrating our nurses. How about that? Okay. So, but before you go on, Luanne, who's the organizing team? Let's have them stand.
I think they're all standing to your right and left.
That would be my left. And over here. Thank you for making that happen. Anyway, we're pleased to welcome about 50 of your colleagues who are here with us tonight, representing nursing and friends of nursing. Right? So anyway, and for those of you joining us virtually, I'm told there are about 300 of you. I'm sure there are many more because you've gathered your family to join you as you watch this fascinating show. As you all know, we're also celebrating National Pediatric Nurses Week. And that's a thing. That is a thing. The other thing we should remember, we're a women and children's hospital, so it's not OB Nurses Week, but we love our OB nurses too, don't we? Cool. I've been trained well by my OB nurses that this is not just a children's hospital. Okay. Tonight we're going to be recognizing and celebrating the extraordinary accomplishments and achievements of our bedside nurses, our nurse leaders, and other care team colleagues. We'll recognize DAISY Award honorees, new certifications, degree attainments, and academic achievements that contribute to nursing excellence everywhere. Kathy, thank you for that. Okay. We received a total of about 144, actually not about 144, exactly 144 nominations for nurses and support staff. With all of the stressors and distractions that we've all lived with during this past year, it's really extraordinary that you've all taken the time to recognize the hard work and dedication of your coworkers. And that's sort of what makes the culture here of working at Packard pretty extraordinary. Luanne was kind enough to share a quote from Florence Nightingale. Now, Florence Nightingale, she's a wonderful woman, or she was a wonderful woman. She's no longer with us if you hadn't heard. But Florence wasn't very quotable, so it was hard to find things that she said that were pithy and really with it. And so, sorry, we love Florence, but she just wasn't that kind of person. But Luanne did find for me a quote that I thought really works with this crowd. For the sick, it's important to have the best. Simple, heartfelt, and absolutely on spot for what we're doing here tonight. So Florence, Nurse Nightingale, as I like to call her, would be thrilled to know that here we are 110 years following her death, keeping the promise that she made to humanity. And that's all of you. So thank you for doing that. I look back to the first few months of this craziness of the pandemic when it was just beginning back in February, March of 2020. And we didn't know much about it, but we knew it was bad and it was going to probably get worse. And but what we did as we did what we always do in healthcare. When everyone else is running for the exits, running away from danger, what do? We turn around and we run into danger. We lean into harm's way. You lean into harm's way. And this past 18, 19, 20 months and counting has been just a testament to the extraordinary work that each and every one of you do. I remember with pride the Heroes Brigade that, remember our first responder colleagues when they set up that wonderful brigade of police officers and fire persons. I was going to say firemen, I'm trying to be politically correct. Fire persons and EMTs and with their flashing lights and their mini signs. And I saw many of you coming into the hospital that morning, tears in your eyes, because it was just such an emotional moment to be recognized for the work that you do, along with those other first responders. And just that well up of emotion of all of the hard work that you do every single day to take care of others, that selfless work that you do every single day, every single shift, that's pretty extraordinary. So what we're trying to do here tonight is to capture that same spirit virtually, to those of you 300 plus out there, and the 50 here who are with us, to have that same sort of heartfelt appreciation for the work that you do every single day. As nurses, I get choked up just thinking about it. As nurses, you represent the consistent and caring presence of our entire care team. I know that all of you, because you're so humble, would be quick to recognize it's not just about us. There are many other people on our care team who also contribute to this, you would say to me. But after a couple of glasses of wine, you would say, it's all about us. It's all about us. So tonight, it is all about you. And so that's what it's going to be. We love our administrators, I know, and all of our therapists and our social workers and our housekeepers and our supply chain folks. And they play a critical role, and we'll celebrate them on their week. But tonight, it's about nurses, only about nurses. And so I'm thrilled to be here as your president and humble servant. And enough of me, back to the ceremony. Luanne, Jesus, who's on charge here? Thank you.
Well said, and thank you, sir. One of the things I enjoy about working here is the support I get from all my colleagues, especially Paul and Rick. And you'll meet Rick later at the closing of the ceremony today. So, we're thrilled to have you here, so let's get this party started. Today we're celebrating you and honoring all of the extraordinary care that you provide to our patients and families every day, every patient. As many of you know, we celebrate this event each year during Pediatric Nurse Week, also National Midwifery Week for all our maternity nurses. So congratulations to our maternity nurse colleagues. For most of the year, this event has been able to honor many of the categories for nursing achievement. Unfortunately, as we've already said, because of the pandemic, we can't have all of the nurses that we're honoring, from the DAISY Award to Excellence Award to Safety Awards to PMDP advancements, advanced degrees, evidence-based fellowships, and our published nurses that we're very, very proud of. So unfortunately, we can't have everyone here in the room with us, but their names will be scrolling on our board up there so you could see and we could recognize them. Today, we have 17 Excellence Awards winners this year, 4 of which are exclusively advanced practice providers, 10 of which are exclusively to nurses. 1 will be awarded to a friend of nursing, and I will be awarding a friend of nursing, especially a special award to a physician. 1 new added event last year was Excellence in Precepting. This can be awarded to any healthcare professional, including nursing, that precepts others. So those are the categories for tonight's event. So let's get started. Our first category tonight is Excellence in Advocacy. This award is recognizing a registered nurse who excels in advocating for children, pregnant women, families, and/or staff. The nominees are Maria Sage, Deborah Alueta, Michelle Sarno, Renee Billner Garcia, Linda Ritter, Angela Durr, Natalie Pacheco Lockridge, and Tiffany Inez from the NICU. And the winner is Deb Alueta.
So Deb is a Caritas coach, chair of the Research and Evidence-Based Practice Council, co-author of a QI project for early identification and intervention of depression in high-risk hospitalized AP patients. She presented at the Healthcare Con in 2021 as a podium presentation. Deb was the 2020 chair of the Antepartum Committee in a Maternity and created a proposal for the comprehensive AP Wellness Program. This program identified that stress reduction modalities were needed to help relieve depression and anxiety to better serve these long-term hospitalized patients. This program was presented to leadership and ultimately was funded with a grant from the auxiliaries for wireless fetal monitors, allowing these patients to be more mobile while hospitalized for so long. Congratulations, Deb.
Just quick side note, Deb is one of the first nurses I met when I started rounding in the hospital, and I was rounding through the NICU, and she was telling me all about the Aqueducts program and how much great achievements they had achieved in the last year, keeping babies that previously have been dying safe and thriving on Aqueduct. So thank you, Deb, for all you do. Our second award tonight is the Award for Excellence in Quality, Safety, and Improvement. This award recognizes a registered nurse who promotes leadership performance, teamwork, and improvement in the healthcare quality and patient safety at levels of the department or at the organization. The nominees are Natasha Rijkamura, Allison Wills, Jennifer Tanaka, Lynn Begazi. And the winner goes to Allison Wills.
Allison is our department's patient safety representative, resource nurse, PD super user, and continuously focuses her efforts on providing safe and reliable care. She's always thinking of innovative ways to improve small issues on the unit that impact our workflow and puts in the work to make effective change. She is not only an effective teacher for her patients and families, but also challenges all of her colleagues to think of ways to improve her care.
Our next award is Excellence in Teamwork. This award recognizes a patient care unit or department that has shown excellent outcomes and improvement in their outcomes. Employee engagement, press Ganey hacks employee injuries over the course of the past year. The nominees this year are Maintenance and Engineering, PCU 500 and 520, Wound Care Team, ICN, Interdisciplinary Care Teams, PEC at El Camino, and COVID testing and vaccine teams. And this year's winner is the Wound Care Team.
So this nomination was actually from the music therapist. So she said, I've had the extreme fortune of working alongside the wound care team for several years. I reflect on my many interactions and co-treatments with awe, and am so appreciative of the opportunity to work with kind, compassionate, and patient nurses. This team is open to support from other disciplines, always keeping the patient and family-centered care a top priority.
Another aside, I'm sorry I'm going off script tonight.
No, please go off script, and we can probably slow down a little.
Thank you. I just want to commend the wound care team. It's a small but very mighty team, right? I really wish we had more of you so that we could really tackle our wound happy issues. So thank you so much. We appreciate everything you do for our patients.
And just as a side note, I will make sure you all get the full nominations because they are extraordinary. And so you will get to read them all the way through.
All right. Now I'm relaxed. Sorry, I was getting nervous at the beginning. All right, our fourth award is our Emerging Talent. This award recognizes a registered nurse who has less than 2 years of nursing experience, who demonstrates exceptional compassion, a desire to grow within his or her professional practice role. Our nominees this night are Molly Clennon and Kiana Hood. I got that name right. And the winner is, can you guess? Kiana Hood. Congratulations.
Not only is Kiana an exceptionally strong nurse, she easily works in collaboration with our multidisciplinary team, ensuring that her patients' needs are covered from every angle. Kiana was asked by a family to be their primary nurse, who at that point was working on feeding and growing. During her time caring for this patient, he became sick and was ultimately diagnosed with a chronic condition that would acutely require more complex medical care. Despite being one of the newest nurses on the unit, she cared skillfully and with her whole heart for this baby, who became the sickest patient on the unit for a while. She said that by caring for this patient, she's learned to care for the many different types of NICU patients, growing and learning as a nurse. Congratulations, Kiana.
Okay. Our fifth award tonight, we're going to switch gears a little bit and give out our awards that is not going to a nurse. This award is Friend of Nursing, and it's specific to one of our physicians. This award recognizes that quality patient care is only made possible by the support of many different healthcare professionals collaborating and working together. Our nominees are Grace Lee, Associate CMO, Doug Seidel, ENT, Jagus Pawar, OBGYN, Susan Crow, OBGYN, David Scher, Oncology, Christine Walravens, Pediatrics, Adwell Wu, Neurosurgery. And the winner is David Scher.
He's not here.
I know. Unfortunately, David could not be here tonight, but we will accept the award on his behalf. Our sixth award is Excellence in Research and Evidence-Based Practice. There you go. I knew Annette would do that. This award recognizes a registered nurse who demonstrated a commitment to advancing science and scholarship through research and evidence-based practice. The nominees are Gia Chang, Jocelyn Lazaro, Alisa Ben Baruch. And the winner is Jay Chang.
G's interest in mom and baby dyads, specifically in breast milk feeding practices, has driven her to have a passion in research on this topic. She's designed and led 2 QI projects on the maternity unit. One involved the use of human-banked donor-exclusive breast milk feeding. The second looked at mothers that screened positive for COVID. Her project investigated the effects of our hospital's maternity care practices, such as skin-to-skin, rooming in, and breastfeeding, on the risk of developing COVID for the newborn. She presented at Healthcare Con, the Academy of Breastfeeding Medicine, and the International Lactation Consultant Association.
Lots of exceptional nurses tonight, and I know we have lots more on Zoom tonight and at home, so thank you. Our seventh award today is Excellence in Mentoring. This Excellence in Mentoring award recognizes a registered nurse who excels in fostering and mentoring environment. This nurse will be mentoring others and peers. The nominees are Vivian Pacquet, Vincent Pena, David Rego, and Ella Mendoza, Rhonda Bioepple, Tassilia Rogers. And the winner is David Rego.
David is one of the few nurses on PCU 400, if not the only one, who has the seizure pathway and stroke code pathway memorized. By being such a great resource, he has helped mentor several newer nurses during stroke codes and status epilepticus by confidently and respectfully nudging them in the right direction, all while assuring the patient is safe. David is also the co-chair of the Acute Care Brain and Behavior Specialty Service Resource Team. Congratulations, David.
Great work, David. Absolutely.
For those of you on Zoom,
let's
Kathy
write that
Bradley
up.
said it sounds like a magnet story.
Our next award is Excellence in Nursing Leadership. This award honors a registered nurse leader from the bedside care to director who bullies.
Ouch.
Can you tell I'm doing this without my glasses?
Where are they? We'll find them for you.
Oh, a director who builds excellence and empowers others in fostering environments while excelling as a role model and practicing behaviors that increase morale and strengthens the organization. The nominees are Jamie Vick, ambulatory, Charlene Noach from PICU, Rachel Fritsch from PCU 500-520, Angela Johnson, L&D, Reggie Capolo, Advanced Practice, Kat Cueto, Clinical Access, Jean Pattison, PCU 300, Shannon Phenom, Critical Care, Christine Foch, PICU, Adrian Corrales, Radiology, Teresa Catatala, PEC, and Jermaine Albano, OB Clinic. And the winner is Jean Pattison.
Woo! Jen ensures delivery of high-quality service and care, ensuring her staff are supported and going above and beyond when needed. She was a constant on the Magnet journey, supporting people working together to achieve a common goal, one that would benefit the organization. This year, she was tasked with the unprecedented task of converting a unit to a COVID landing zone. During this time, she kept everyone updated to the constant changes, making sure the unit was well supported physically, emotionally, and mentally. Her strength lies in her quiet and strong leadership style. She's created an environment that is so inclusive and team-oriented that it helps counterbalance the high acuity and stresses of day-to-day work. She is an amazing nurse leader.
Congratulations. Our 9th award, we have another Friend in Nursing award. To give that, it is not a physician that we will turn to now. It's always a crowd favorite, and these are nominees for people that really are partners with nursing at every level. So today, we had a lot of nominations for this category, which is great to see, because it's great that we recognize that we can't do all this by ourselves, that we really do need strong partners to care for our babies and parents. So this award recognizes that quality patient care is not possible, and it's not a nurse. So we're recognizing 23 individuals today. Robert Hoey from Peds Critical Care Transport, Hilda de la Gildilo, PCU 500 and 520, Jessica Bayer, ICN, Samantha Johnson, Child Life, Catherine Kraus, Child Life and Creative Arts, Jenna Kruger, Quality Improvement, Lorraine Oak-White, Pediatric Urology, Sean Green, Pharmacy, Mona Cruz, CPEI, Farah Shah, PEC, Jerry Watson, Bass Center, Carly Mariano, PICU, Amy Valencia, Infection Prevention and Control, Asing Jahadi, OR Perfusion ECMO, Yesenia Romero, Lab, Gina Jill, Maternity, Mariana Shemeg, Housekeeping, Silvana Daniluk, PICU, Tuesday Simmons, Respiratory, Marissa Neng, Pharmacy, Kawhi Mark, Pharmacy, Kawhi Mack, Pharmacy, Mary Lou Bigby, Bass Center Clinics, and Walter Brienne, Chaplaincy. That was a lot of people that really deserve recognition. But the winner is Kawhi Mack from Pharmacy.
Kwai is someone we all wish we could duplicate. She has caught many medication errors before they reach the patient, coaches physicians on safe medication practice. Sheila was her nominator, by the way. Educates nurses on new treatments, teaches families about their DC meds, and trains students, all with a smile on her face and a sense of humility that is remarkable. She can flip from having a high-level conversation about a medication to teaching a family with low literacy within seconds. She's quick to respond to all asks, whether that be determining high-use meds and how to dispose of them safely, to creating a list of compound meds that need extra time to be ordered in the outpatient pharmacy. When she's on vacation, you'll often hear during rounds, "What would Kwai do?"
And you know, our pharmacy team are really unsung heroes. I've worked in a lot of children's hospitals and some adult hospitals, and there's always been, you know, pharmacy nursing issues. In 10 months, this organization has really built a strong collaborative efforts with our pharmacy team, and I find them to be the most trusted collaborators in our patient care. So thank you, pharmacy team. All right, our next award is Clinical Excellence in Nursing. This award recognizes a registered nurse with at least 5 years' experience who excels in pediatric and obstetric clinical practice. Our nominees are Nang Hu Yang, PCU 400, Amy Freha, NICU Critical Care Transport. She's a little biased, but we understand. Elizabeth Bella, ICN, Brent Seaman, PICU, Cheryl Pattison, PACU, Holland Buriti, PICU, Jacqueline Arigla, Maternity, Roberta Hurryman, NICU, Marissa Balog, Bass Center. And the award winner is Holland Buriti.
Holland is a clinical nurse 4 that clearly shows and shares her excellence in nursing practice. She's knowledgeable in our policies and procedures and carries out her nursing skills exceptionally and with grace. Holland carries herself in a professional, approachable manner on the unit and is a role model for novice nurses and works well with the interdisciplinary team. She has a strong desire to grow her professional development and is a certified critical care nurse, serves in the team lead role often, and holds herself to a high standard. She's a knowledgeable resource in the PICU that many nurses look to for advice and help. Congratulations, Holland.
Our next award is Excellence in Innovation. This award recognizes a registered nurse who demonstrates excellence in creativity and innovation. This year's nominees are Catherine Kent, PICU, Mary Tweedy, PACU, Ashley Solomonani, NICU, Lynn Begazi, wow, I said that name several times tonight. Congratulations, Lynn. And Courtney Erickson from the Bass Center. The winner is Catherine Kent from the PICU.
Woo! Katie, I think this might be your second Nightingale Award. Is that right? Yes. Katie's always looking for new and better ways to care for our patients and is not afraid to challenge things when a current practice seems outdated. When the PICU educator left the position, she enthusiastically jumped into the role. In this new role, she did extensive research on a new product called the nasal bridle, which is an NG tube securement device. Her research led to a trial study of this product, and education is currently underway to roll this out throughout the hospital. Katie is not afraid to push boundaries and try something new, ever.
And congratulations, Kate, on your recent engagement. Let's give her a hand. Engaged to one of our other ICU nurses, so congratulations. And you know that bridal work is going to really go hospital-wide in November, and it really is going to change the care that we give to our kids and just the comfort of not having to worry about NG tubes falling out. So I think that's going to be a very big change for our patients. So great work, team. Kate. All right, our 12th award. Our 12th award is Excellence in Precepting. This Excellence in Precepting Award recognizes a healthcare professional who excels in fostering a learning environment. This candidate may precept new hires, new graduates, or students. The nominees are Caitlin Kozleka, PICU, Kimberly Davies from Bass Center, Natasha Buxton from NICU, Julie Hansen from Vascular Access. There you go. Lindsay Kachuman from PEC. Melissa Seeley from PCU 300, and Karen Yoba Kwang from the Bass Center. And the winner is Natasha Buxton from the NICU.
Natasha is simply exceptional. She is a superior teacher preparing students and new graduates to be exemplary nurses while caring for complex patients in an ever-changing environment in the NICU. Natasha created an orientation pathway for the Vizient residents in the NICU involving management, educators, resource nurses, and fellow preceptors to help implement this program. The new curriculum helps to facilitate appropriate assignments, including a no patient assignment first shift. She's created checklists, teaching skills classes, and provides informal teaching. Natasha is dedicated to the nursing profession and brings incredible energy, insight, experience, and knowledge to educating her students. Congratulations, Natasha.
And congratulations, I hear you just got married on Friday? Whoa! Congratulations. Innovation and Improvement is the next award. This award recognizes an APP involved in advancing industry-leading practices to further pediatric care. This commitment should be demonstrated through implementation of improvement ideas and dissemination of pediatric knowledge at the local, regional, or national level. The nominees are Amelia Sperber, Lynn Mastretti, Jennifer Buzzi, Jenna Murray, and Nathan Chang. And the winner is Lynn Mastretti. Lynn could not make it tonight, so we will be accepting her award. Sorry she couldn't make it. And she's sorry she couldn't make it. All right. Next is the Preceptor of the Year Award. This is an APP award also. The Preceptor of the Year recognizes an APP who goes above and beyond teaching the next generation of APPs. The award recipient must demonstrate a consistent commitment to mentoring APP students on a one-to-one basis and promoting critical thinking and critical decision-making. The nominees are Jenna Murray, second award, nomination, sorry. Allison Giacolone, Reina Lozani, Mary Jane Algioni, Baher Faradani, and Kylie Geis. And the winner is Kylie Geis.
Keely began, this actually looks like it came from one of your students, possibly, yes? Yes, thank you. Keely began my rotation with a general overview of conditions seen in her clinic and provided hands-on opportunities to practice the special physical examination techniques with her and other staff in the clinic. When managing patient visits, she slowly progressed to allowing me to see more complex conditions. After every visit, she would provide me with an opportunity to present my assessment and plan to her before having to discuss it with the patient and family. That was nice. She allowed me to be independent, but always provided backup. Congratulations, Keely.
And our third APP award, this is the Rising Star Award. This award recognizes an APP who has been advancing practice for who's in advanced practice for less than 3 years, who has been making a large impact in a short time through exemplary practice, leadership, service, and education. This award highlights significant contributions from a new APP who has made substantive and positive impact to the organization and the APP profession through projects, research activities, and innovative ways that benefit our children. The nominees are Christy Lechish, Amanda Zetner, Christiana Ratkovich. And the winner is Christine Ratkovich.
Christina has demonstrated excellence in clinical care. And actually, this nomination was extraordinary. It was hard to pick out pieces to read tonight. It was really nice. She started with Packard at the beginning of the pandemic and began her training remotely during shelter in place. She did not let that deter her from learning a complex service line and being ready to jump into action when she began her weeks of inpatient service. From the very beginning, it was clear she was motivated and determined to learn pediatric transplant medicine in every capacity to deliver high-quality care to our patients every day. She's developed strong relationships with the transplant nursing staff and makes herself available to them for questions and consultation. As such a new APP, Christina has taken on so many roles: clinical practice, education, precepting, and quality improvement. She's passionate about her work and is always willing to step in and help out and participate in advocating for transplant patients and Packard as a whole.
And Christina's a PA, and one of the other things that I've noticed that's different about Lucille Packard, and it's really something you should be proud of, is that our APPs are one group, and it doesn't matter if you're a PA or an NP, they really do coordinate, they really do support each other, and I feel it's just one team, and that is special about Lucille Packard APPs, so congratulations to all APPs. All right, our next award is Exemplary Clinical Practice. This award recognizes an APP who demonstrates a commitment to outstanding clinical practice that goes well beyond the traditional service roles of APPs. This recipient must have continuous commitment to clinical care as reflected in a variety of programs and initiatives which are responsive to clinical and psychosocial needs of the pediatric and/or OB patient. The nominees are Lindsay Barkoff, May Casasso, Stephanie Klee, Kathy Castiglio, Melissa Gustafsson, Kate Johnson, and Christine Lin. And the winner is May Casasso.
This was another awesome nomination. You don't want to be the nurse that slacks off and compromises the health of one of her patients. Scary. She's got that mom face that brings you joy when you do right by her patients and makes you want to hide in your room when you blow it. Is all okay, May? May is someone I, as a bedside nurse, actually, David, I think this is your nomination, David Rago. I do think so. May is someone I, as a bedside nurse, consider to be a personal mentor. To say she's taught me a lot and helped me to grow as a nurse would be a ridiculous understatement. She has enhanced my knowledge, my colleagues' knowledge, worked to increase our autonomy, enhanced my critical thinking where our most critically ill patients are concerned, and thus enhanced the care my unit and others deliver to our patients. Congratulations, May.
And our last award is the Eminence Award. This award honors a registered nurse who serves as a cohesive source of support and stability for our patients, families, and colleagues. They are advocate, team players, change agents, role models, and leaders. The nominees are Eleanor Lynn from maternity, Yvette Kiers Moirago from El Camino, Mayorga, sorry, El Camino, Jody Ajo from Critical Care Transport, Leslie Ciralo from PICU, and Minnie Shishibu. And the winner is Yvette Kiers Moirago.
26 years in, Yvette. Yvette has been a nurse for 26 years here at Packard. Through this time, her enthusiastic spirit of compassion and caring has been ever evident. Her badge is covered in rose awards from the many who have recognized and acknowledged the special way that she cares. Whenever she's on the unit as the charge nurse, you know that no matter how crazy the day is, no matter what happens, everything's going to be okay. She has everyone's back and takes her responsibility to have the unit flow smoothly for the patients and staff seriously. Her ability to look out for everyone increases the team's loyalty and even capacity. People want to help the person who helps them. She leads by example. Congratulations.
You know, one of the first off-site visits I made when I first started was at El Camino and PEC, and she and I spent almost an hour talking about issues and things that we could be doing better and our special needs patients. And El Camino is a little hidden gem. I wish we could really continue to build and grow that program. And I'm glad that we are such one family here. And although you may be off-site, you're really one part of our nursing program. We're all one. So thank you for that. Well, congratulations to our honorees, our nominees, and our winners tonight. But this night cannot end without recognizing a special group of people that I think Paul started with already, but I do want to call out the names. This event takes a lot of planning, coordination, and with the pandemic, I know it has not been easy. This team has really pulled a wonderful event for the people that are here and the people that unfortunately couldn't be here because of COVID. We thank you for attending tonight. But the committee that put all this together was Ali Orlandi,
Raise your hand, raise your hand.
Nicole Schubeck, Kirby Jacobs, Sheila Connolly, Ashley Suleimani,
Where is Ashley?
JJ, who's always here and helping. And, of course, Luanne, who, even as of today, was on the phone making final changes because 1,000 things changed in the last 3 weeks. So much appreciated to the team for putting this together.
I couldn't have done it without this team here. They are amazing.
And for our closer tonight, which he's always our closer, I'm going to invite Rick Majzun, our Chief Operating Officer, to come and share his thoughts.
Can I say one quick thing?
Sure.
You know, Jesus alluded to it, but honestly, this event has been much more challenging to coordinate than the drive-in last year. I know that sounds strange, but really it was. There were just a lot of changes, a lot of questions about how we would make this work. And honestly, we could not have made this happen without Claire. And Claire, I just want you to come up, please. Claire has helped us. She's from Li Ka-shing, and she has been extraordinary. I mean, we had changed it probably 9 times. And every time we called her, she said, no problem. She sent us a new sketch. She sent us a new plan, a new quote. She never complained and was always pleasant and had a smile on her face. So I just want to thank you from the bottom of our hearts for all that you've done to help us pull this off. Thank you so much. Thank you. Thank you, thank you.
It's my pleasure.
Of course. We're so thankful.
Thank you.
So this is a little different than last year. Allie and Sheila are not out of breath, and we don't smell exhaust fumes, which is also nice. But listen, I just want to tell you, I am just inspired by what I heard tonight, by what we get to experience every day. For many of you know, I have a daughter who's a senior in nursing school, and so I've been close with nurses for the last 30 years, but increasingly I'm really feeling just the amazing life that she has ahead of her. And in all of your stories, I see her future story. And so as a dad, it really just touches my heart. You take such wonderful care of each other. You take such wonderful care of our patients and their families. I know that I can speak on behalf of all of the executive team, including one of whom is a nurse also, Jill Sullivan, who, while in her role, she doesn't act as a nurse. Everything she brings to the table has that in her, and it makes us such a better team. So on behalf of all the executive team, Jesus, Paul, Jill, and the rest of us, thank you for everything that you all do. Congratulations to all the winners. Thank you to the organizers, and have a wonderful, wonderful evening. Thank you.
Okay, a few quick items. Those of you that got awards, if you could, we have boxes for your glass statues, so you don't have to try to carry those home and get them home in the car without breaking.